Upstate Medical University in Syracuse, New York, invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. We may think of high cholesterol as a concern for adults, but this condition is affecting a growing number of children and adolescents. For help understanding some important new health guidelines, I'm talking with pediatric cardiologist Dr. Christopher Prendergast, who is a clinical assistant professor of pediatrics at Upstate, specializing in cardiology. Welcome to The Informed Patient, Dr. Prendergast.
Thank you so much for having me.
Can you start by telling us what cholesterol is and what it does for our bodies?
Absolutely. Cholesterol is something that our bodies make and is part of all of the cells in our body. Our body has systems that regulate how much cholesterol is sort of healthy or not. And depending on our diet, our other medical problems, that number can go up or down. And when it's too high, that is what causes heart disease and heart attacks ultimately by clogging arteries.
Where does it start in the body? What creates it?
It's made in your liver by a variety of enzymes that break down things that you eat. So that's what breaks it down into different types of cholesterol particles. Like we hear about bad cholesterol, which is LDL, and there's HDL, the good cholesterol, and then triglycerides, which are generally fats and sugars that you eat. You bring them in by nutrition, and then your liver processes them by breaking things down into those various particles for use elsewhere.
So it's a problem to have too much cholesterol. What does it do that is beneficial for the body? I mean, don't we need cholesterol?
Yes, absolutely. So like I said, cholesterol is part of all of the cells in your body. So it's used to form the cell walls. And so it's absolutely important for just building and maintaining normal cells and normal biology that occurs every minute of every day in your body.
How would a parent know or suspect that their child has a problem with cholesterol?
In general, you wouldn't. There's no symptoms or anything like that. They're not going to come to you with specific complaints. You're not going to notice anything when they're playing or when you're holding them or anything like that, except for very, very rare occasions where you kind of get lumps and bumps on your skin. But that's very, very rare. There's no outward signs typically. So usually if parents suspect it, it's because they had very high cholesterol at a young age, or if there's a very strong family history of heart disease at young ages in their family, that is another tip off that maybe there's going to be a cholesterol problem that a kid might have.
When do you recommend testing a child's cholesterol level?
So I agree with the universal screening guidelines. The universal screening guidelines suggest that all children be screened for high cholesterol between age 9 and 11, and then again after age 17. There are instances where a pediatrician would do that sooner, down to even age 2, depending on what the situation was. But that's a generally good guideline that pediatricians can use and parents can ask their pediatricians about.
So let me ask though, if the child has other health conditions, I'm thinking about diabetes, would that be a reason to test them
Yes.
earlier?
Yes. And so other health conditions, if a child's very obese, if they have very high blood pressure, diabetes, kidney disease, and a thing called Kawasaki disease, those are all reasons to potentially consider screening a kid earlier. But the key with the screening guidelines is we want to screen every child at between 9 and 11, because if we only screen based on children's other medical problems, we're going to miss some of the most important causes of high cholesterol in kids, which are generally genetic and not related to other medical problems.
I see. Now, what is the normal range for kids? What should their
Yeah.
cholesterol numbers be?
In general, it depends on the number you're looking at. So we have three things that we really consider the most are LDL, HDL, and triglycerides. A normal number for an LDL in a kid is generally about 110 or less. A normal number for triglycerides in a kid is going to be 150 or less. And then HDL, that's the number that you generally would like to be on the higher side. So normal values are usually kind of 45 and above, but higher can be considered protective with some exceptions.
So all of those numbers matter.
All of the numbers matter, and they're all abnormal in different problems. And that's one of the problems with the way that some screening occurs, honestly. So many people will get screened based on the fact that they have obesity, for instance, or diabetes. And when you screen kids based purely on obesity and diabetes, you're generally selecting for kids that have problems with triglycerides and HDL. Whereas what we really care about in terms of preventing heart disease is the LDL. And that's a big reason that screening is recommended for everyone, because kids that have genetically very high LDL are the kids that are most likely to have heart problems later on in life. And those kids will be missed if we're only targeting our screening based on their obesity, their body weight, their diabetes, and all those other things. And so by selective screening for those other problems, we miss a lot of kids that are otherwise perfectly healthy, no symptoms, normal body weight, no high blood pressure, no diabetes, but are walking around with very high LDL because they're just genetically programmed to do that.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with pediatric cardiologist Christopher Prendergast about high cholesterol in children and adolescents. If a child's numbers are troublesome when the blood work is first done, is there any immediate action that needs to be taken?
Usually, it depends on what the lab values are and what's abnormal. But usually the first thing is to repeat it. And many pediatricians will have a kid work on nutrition for a period of time and then repeat it. There's typically no emergencies that are related to their cholesterol. The whole purpose of capturing these lab abnormalities is to understand them and to be able to decide to intervene in a reasonable way to prevent problems from happening way down the road in their 20s, 30s, and 40s. So there's no immediate problem in general that we're worried about for kids with high cholesterol, unless the numbers are very, very high, which is a very rare diagnosis. So for most lab abnormalities, the first step would be some nutritional intervention, some lifestyle counseling sort of things. And then if they're persistently high, certainly referring to our lipid clinic where we can get into it a little bit further.
The American College of Cardiology and the American Heart Association and several other medical groups recently updated guidelines to emphasize earlier treatment of high cholesterol, even starting as young as like the 30s. Is the point all about reducing the risk of heart attack or stroke?
The whole idea with treating high cholesterol is to reduce the risk of heart attack and stroke and heart disease and all the things that come along with that. The idea of intervening at a younger age is really based on the idea of lifetime risk. So the traditional way that we've assessed someone's risk for having heart disease based on all their risk factors is through something called 10-year risk. So you're looking at in the next 10 years, is someone likely to have an event? And that generally works for most people. The problem with 10-year risk is that it misses a lot of young people that have other risk factors, because the most powerful risk factor for development of heart disease or stroke is your age. So kind of by default, if you take a young person and put them into your calculator for what their risk is, their 10-year risk is going to be low because they're young, even if they have high cholesterol and high blood pressure and all that sort of stuff. And there are a lot of people with genetically high cholesterol, like I've mentioned. And those people are walking around with a very high LDL for their whole life. Their lifetime risk is 5-fold greater than the general population. So 95% of people with genetically high cholesterol will have some sort of cardiovascular disease in their lifetime. And if we think about them in terms of 10-year risk, then when they're young, we will often miss the opportunity to better control their risk for cardiovascular disease. That's why the shift in looking at younger people kind of exists, is to try to get more of a sense of lifetime risk. And that mentality, though the reasons that we treat a kid for high cholesterol are often different, that mentality is how we think about kids in terms of their high cholesterol, is trying to find the kids that have genetic high cholesterol. It's a problem called heterozygous familial hypercholesterolemia, and occurs in about 1 in 200 people. And we're trying to capture those kids because they're at the highest risk for having heart disease at relatively young ages.
Do you treat high cholesterol in kids the same way that you would in young adults or adults with statin medication?
Yes. So our threshold to do that is different. We're mostly looking to capture those kids with genetically high cholesterol because we know that if we find them when they're relatively young and lower their very high LDL with medications, we drastically reduce their risk of developing heart disease at young ages. There are other kids that don't have genetically high cholesterol that we will also treat with statins. And those are kids that have diabetes, kidney disease, obesity, all those other things that we've mentioned. But the threshold to treat them is different than the genetically high cholesterol kids and different than in adults.
So, what is the outlook for someone who is diagnosed with high cholesterol in childhood and needs to be treated for it?
It's very good. When we can identify these kids in their teens, for instance, and know that they have a very high LDL, we get them on medications well before it ever becomes a problem. And if we follow them, then we can keep their cholesterol low through their entire life and oftentimes give them a lifetime of lower cholesterol than many people of the general population because we're keeping such a close eye on it and keeping it controlled with diet, exercise. Those are always the first things, and medications when we need to.
If they start on a statin when they're young, is that a medication that they'll be on for the rest of their life?
If it's genetic, then generally, yes. There are kids who go on it because they're very obese and then they lose a bunch of weight. And when they're a little older, after they've been on medications, they can potentially come off. But for the most part, again, we're looking for these kids that have genetically high cholesterol. And when you're just genetically programmed to have very high LDL, there's really no amount of diet and exercise you can do to keep it at a healthy level. So that will often require medications for life.
Now, is this something where typically the pediatrician would refer the child to a cardiologist or a pediatric cardiologist to follow this?
Yeah, certainly in our area, that would be, and I'm a pediatric cardiologist that focuses on this. It's an interesting little kind of niche in medicine where, depending on where you live, it may or may not be a cardiologist that has specialized in lipid disease. Some places it's an endocrinologist. In some places, there are general pediatricians that have done further specialty and are knowledgeable about this. So it's a very broad pool of backgrounds for pediatricians that have specialized in lipid disorders. There just aren't that many of them. And that becomes a challenge too, because having the resource of someone that is focused on these types of problems, not every region has one.
And do they stay with you until 18 or 21 and then go to a regular adult cardiologist?
I follow them forever. I trained in both internal medicine and pediatrics. So I'm an adult and pediatric doctor. And so in our general cardiology clinic, we see children with congenital heart disease, and we follow them as adults. And then all of the lipid people, their kids, as they graduate into adulthood, I keep them. And many of their parents will become my patients. And because I'm one of the only lipid specialists in their region, I also get referrals for complicated adults with complicated lipid disorders. So our clinic is full of adults and kids all the time.
Well, very interesting. Thank you so much for taking time to
Absolutely.
explain this.
No problem. My pleasure. Thank you for having me.
My guest has been Dr. Christopher Prendergast, who's a clinical assistant professor of pediatrics at Upstate, specializing in cardiology. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.